Well, welcome back to the companion podcast of Hope in Action, where we have an extended conversation with one of our guests from the show. And this month, we're super excited to have Yolanda Pope of DAP Services and Resources. Yolanda, I'm so excited to be able to continue our conversation. So, as an LPN, did you see a need born out of that role that you had that is now what really?
Absolutely.
Okay.
Absolutely. Working as an LPN across several different types of healthcare spectrums is really what got me to starting DAP Services and Resources. Just seeing the needs out in the community and just the deficit, for the families. I mean, when I was working in long-term care or senior living or even acute care, but the results were still the same. We had seniors and their families that were out in the community that really had access to resources that they weren't utilizing because they didn't know they existed.
Mhm. And you saw that even with managing their cases, understanding their doctor's appointments, but it went deeper than that, didn't it?
It did. So the core of what we do is case management, and that was initially what DAP Services and Resources started out to be, is a organization to assist with case management for those individuals who didn't have access. But very quickly, we started to identify a larger community need, and that was housing and supportive services for seniors that were in between housing in our community. And so that is what led us to our senior stability program. And that program was launched in January 2025, and it really was based out of a community need.
Because originally this was born during COVID, right?
Correct.
2021, and then fast forward to 2025, and that's where really you said, wow, people are without housing. And if you don't have those basic needs met, the rest of it doesn't work.
That is correct. And so we started to notice, I would say mid 2024 is when we were starting to get a lot of referrals and have a lot of clients that had housing needs or housing insecurity. And there weren't really a lot of resources available to support our population. When it comes to seniors and their needs, it is not as simple as just housing. Oftentimes they're managing chronic health conditions at the same time. And so that is what really helped us change our focus, and to focus on how can we make sure that we're meeting the needs of the seniors in our community, with our core case management, supportive services, and now housing services too.
And that is Harbor House, right?
Correct. So our senior stability program is the umbrella of our housing services. And so Harbor House was created because initially with our senior stability program, the goal of that program was to find a way to keep our seniors that were in between housing sheltered, so that way we can stabilize their care. But we quickly realized there was not a mechanism to do that. We in our community use a shelter or hoteling system. That does not work for our population because they still need access to meds. Some of them need support with meals. There's additional things that are needed, and that just is not ideal for our population. And so Harbor House was born out of the need that we identified through our senior stability program. And so what Harbor House is a transitional shelter specifically for the elderly. At Harbor House, we are able to do our intake and we're able to get our clients stabilized, make sure that they have a pharmacy, a doctor, while also providing the case management services right there on site. One of the beautiful things that Harbor House has really shown us is that we actually get a chance to get to know our clients on a different level and recognize when traditional housing may not be the best option. And that's not something that you can necessarily see if you're just doing case management. You don't always see that. But Harbor House has really given us the opportunity to see and help identify the best living options for the seniors in our community.
And if you can't provide them, then you work with different agencies to make sure that they're cared for.
Correct. Yep. So we work collaboratively with other agencies in the industry. We also have a shared housing option. That's another subset of our senior stability program as well, for our seniors who may not be able to afford housing and who may not have a housing voucher or don't have access to like subsidized housing. And so our model really is evolving based on the needs of the seniors that we have in our community.
It's such a blessing. And I know that, how has your heart changed from when you started this and now you're seeing lives impacted, hundreds of lives?
It's extremely rewarding for sure. It's rewarding, but it's also been a learning experience. You know, when you come into this with as much experience as I've had, you think that you know,
Mhm.
and you think you have a good handle on, hey, you know, this is what we need, but you quickly realize there's so many layers here, and so we are still learning. You know what those layers are, how to peel those layers back, and what partners to work with in order to ensure our seniors have the support that they need. But it is definitely very rewarding to be able to support our community this way, and to see the impact that we have on the seniors in our community.
You know, earlier we talked about the man who came in unhoused and with all his belongings. What other stories have touched your heart? How have you helped, families or a specific senior?
There's so many stories that I could share. I think, you know, the one story that stands out to me the most right now is we had a senior who actually was incarcerated for 50 years.
Mm.
And he was released in the community with $75 and no shelter.
Mm.
And he had a history of mental illness. And so it was a different approach because this wasn't something that we had dealt with before. But we were able to work alongside him and working alongside other collaborative partners in the community in order to keep this individual sheltered until he was subsequently housed. And now he has a job and he has a driver's license and he's, you know, living on his own. But to just see the transformation, you know, in that case, it's just been very rewarding to see him, you know, from, you know, the initial, you know, feelings of despair, uncertainty. It's a whole new world. And now to see him thriving in the community, it just really speaks to why we do what we do.
100%. And those kinds of success stories, because I know you have a lot of support in the community. So, what is your vision for what's next? I know this is always evolving, but so much success to build on.
It is. It is. We would not be able to do this without our partners. You know, I can just CFC is one, Lansing Housing Commission, Ingham County Health Department, um, Ingham County Housing Trust Fund, Capital Area United Way. I mean, there's so many that have really helped us get to the next level. But my vision, honestly, is to have a campus style model for our housing services because one of the things that is unique about the population that we serve versus other housing programs is the seniors in our community and the seniors on our services and in our program, unfortunately, they're not going to improve in most cases. Their health is going to deteriorate. And in most cases, they are going to need more services. And so the goal of our program is not to get them off of services because the population we take care of, they need that service. They need community. And so having a campus style model where we have all of our services under one umbrella, where we have our transitional support, I would love to see a warming center for seniors specifically, and long-term housing under one umbrella allows us to just have the full ecosystem that's needed in order to make sure that the seniors in our community have the support that they need as they age.
Well, and you have to dream it first, right?
Absolutely.
Because I'm sure when you started this in 21, you had no idea where would we be in 2026 and all the success and yeah, how your model had changed. And the need is
Yeah.
so great.
It is. It is. I've documented this whole journey actually on paper. And so it's so interesting to see the components of it that have changed, but also the ones that have stayed the same. You know, we're still sticking to our mission. We're still sticking to, you know, the core values of our organization, but we are evolving in real time. And our evolution is really based on the needs of the clients. And once we see a need, then we change our program model. We adjust our practices in order to make sure that we're able to meet their need because right now that's not something that's necessarily happening in the community and not just our community but as a whole, the challenges that we're facing with our seniors that are becoming unhoused is much bigger than is being realized. This is a big issue, and a lot of our seniors are being priced out of their apartments. You know, and there's not a safety net, you know, for them to fall back on. And so we're that safety net. You know, we're building the programs that we would like to see.
And so strength in numbers, right? Not only the people that support you, but with your staff, and then the people. I like the model of where they're all living together and sharing that shared space if it's all at all possible, because then it gives them a sense of community too.
Absolutely.
Because
Absolutely.
seniors are isolated. They feel isolated a lot, especially if family members are not present in the area.
Correct. And you would be surprised the amount of our seniors that don't have that support. And oftentimes, if you have a supportive family or you're around people that have support, the immediate thought is, oh, well, maybe they have their children or their spouse or, their family. But most of the clients in our caseload do not have that family. And so, like I mentioned earlier, we become that professional relative where we're here to help them navigate through systems. We're here to make sure that they can access resources, but they also know that we're here as a support. We care about their success. If they make a mistake or something happens, they are also going to be accountable, but we're still here. We're not going to discharge you from our services because you're struggling. We know we all struggle. We're going to be here to support you and connect you with the resources you need in order to be successful. And then also to maintain that stability moving forward.
So if someone is listening, which we hope they are watching, what is the first step that they need to take?
The first step would be either to call, give us a phone call, 517-705-3581, or come in during walk-in hours. We have walk-in hours every Tuesday from 1 to 4. We're at 405 West Green Lawn, Suite 100 in Lansing in the nonprofit hub. So just stop in. If we can't help, then we will be able to refer you to someone else who can.
All right. So a couple of exciting things, right? You have your crucial conversations because we understand that sometimes people will come in crisis.
Correct.
But if you can talk with them before they get in crisis, that's really important.
Yeah, Crucial Conversations is our public forum that we use in order to talk about crucial things that affect the seniors in our community. We've been doing Crucial Conversations actually since 2021. It started off virtual and we've done it in person at multiple locations. But the goal of Crucial Conversations is to provide information on how to advocate for yourself at the doctor. What is the difference between different types of living options for seniors? What assurance options are available to you for Medicare when the changes occur? So that way, as things change and they start to have more needs, they know where to go. They have those resources. We are having those discussions, and they're not feeling like they don't know what to do. So that is our goal is to meet them before they get in crisis, and we try to use Crucial Conversations to do that.
What is their number one concern? Is it, I don't have a place to live, or I don't know how to navigate my health care?
So for Crucial Conversations, honestly, the concerns are more around advanced care planning. So we talk a lot about like power of attorney, 5 wishes. We talk a lot about managing your health care as it is now, and having the support that they need to manage their health care or a new diagnosis. We talk about medications, managing multiple medications or some of the side effects. Talk about changes as someone starts to change and decline in their own home. What are some things that they can do in order to make their home more appropriate or fitting for them? Or where could they get help? For those changes. And so the way that Crucial Conversations works is we have one topic, but at the end, we ask them what they want to learn about next. And so they come up with the next topic, and then we find all the resources, and then we bring it back to them. So that way they're actually having conversations that they want and that, they're choosing.
I heard you say 5 wishes. I would like to learn more about that. What is that?
So 5 wishes is a document it can be legal here in the state of Michigan, and is when you determine what your 5 wishes are as you are, whether it's the end of your life or if you're not able to make those decisions for yourself. You determine, who you want to make decisions for you. You determine what type of life-saving measures do you want in place, and not just life-saving, but maintaining. Do you want to have a tube feeding? Do you want to have, a trach if it came down to that? How do you want to transition? Do you want to transition in your own home? Do you want, it talks about all of the things that we don't necessarily put in place. It gives you an opportunity to have a voice. So that way, if you don't have your voice, you are able to explain to the people in your life, what your wishes are. But it also takes the pressure off your family. A lot of times people feel like, oh, my daughter will take care of it or my husband will take care of it. But, when you're in the midst of a crisis, your emotions are high and it clouds your judgment. And so our philosophy is we want to do what's hard while it's easy. And so with the 5 wishes, you can come up with this plan, you can change that plan, you can modify it, and you can let your family know what that plan is.
Because it's hard conversations.
Exactly.
Those are hard conversations to have. So this really just opens the door for it to be very easy.
Yes, absolutely. And that's the goal. That's the goal, is to keep it light, keep it easy, but it's important. It's important conversations that need to be had.
And speaking of conversations, like the golden gatherings that you do, how fun are those? But yet they're dignified, right? For a resource opportunity, but also, hey, let's get together.
Yes. So Golden Gatherings is an event that we put on to really serve our seniors. It is a way for us to get them resources, but it's a different approach. Instead of having resource tables and vendors, we have all the resources there in a folder, and then we also have our needs assessment there too. And so on each table we have our gold box, where anyone that has needs, if they need help getting their meds, getting to the doctor, housing, they fill that out and put it discreetly in the gold box. We take the boxes at the end and we call and follow up with them based on what it is that they need. We do involve our partners. Our first Golden Gatherings event was actually at Best Furniture Outlet. They allowed us to use their store and all their furniture in their store. And so that was pretty fun and exciting. But the last one we had was at the Lansing Center. So we have our partners help us, but usually when our partners are there, they're volunteering. They're volunteering as servers. They're volunteering as, someone that is there to support our seniors, because that is what the event is about. It's about getting them resources, creating opportunities for socialization, and just a dignified approach to having the support you need in the community.
Well, I can tell that you've poured your heart into this. It definitely lights you up when you talk about it. And does it give you hope for seniors?
Oh, absolutely. And, if the hope isn't there, we're the hope. We are the hope that the seniors need in our community. But we have so much support in our community for our seniors. I think it's just been creating the mechanism to see how everyone can fit together as a puzzle piece. And so that's what we're doing.
Yeah, and doing it well.
Yeah, thank you.
You're welcome. Thank you so much. Well, that wraps up this month's Hope in Action Companion podcast, and we really hope that you enjoyed the conversation. To make sure that you don't miss any more, or if you want to go back to others, just subscribe on YouTube, Spotify, or Apple Podcasts. And if you like what you hear, please leave us a review. If you want to connect with us, all you have to do is email us at hopeinactionsj@gmail.com. You can always follow us on Facebook or Instagram. Well, thank you again for listening while we discover more Hope in Action.